Yeah.
Okay.
Yeah, great. Hello, good morning. Welcome to this week's staff brief. I'm Paul Robinson. I'm the Chief Executive here at Sherwood Forest Hospitals, and with me today I've got Debbie Kearsley, Adam Grundy and Craig Short, and we'll be covering the topics of mandatory staff vaccinations and getting an update from Craig on where we've got to on the world map in our Fitness for All challenge and the weekly winners for this week. I'm just going to kick off with sort of a general COVID update. I'm pleased to say that the numbers of patients who are COVID positive in our hospitals has fallen. So today we've got 44 patients. This time last week we had around about 75, and the week before that 113. So you can see how the numbers of COVID positives have reduced. However, transmission rates remain high in the community, and indeed in Mansfield and in Ashfield we remain in the top 50 councils areas for the country. And the R number is increasing slightly, so we must continue to remain vigilant and taking the necessary precautions. That's the necessary IPC precautions, working from home wherever possible, and wearing a face covering at all times when on site, and appropriate distancing. Just on the subject of IPC, infection prevention control vigilance, there have been a number of outbreaks of coronavirus around the country and indeed in the county of Nottinghamshire. So again, IPC compliance will prevent those outbreaks and keep our patients safe while they're in our site. So please be vigilant in that as well. So I'm going to hand over firstly to Debbie Kearsley and then to Adam Grundy, and we're going to cover off the mandatory vaccination of staff. So Debbie, do you want to pick that up, please?
Yes. Thank you, Paul, and good morning, everybody. So I'll just give you a brief overview in terms of the mandatory vaccinations and the timescales and where additional information can be obtained. So on the 6th of January this year, the government made new legislation and amendments to the Health and Social Care Act, which identifies that there is a requirement for individuals who are in CQC related activities or individuals who go into areas where there is CQC regulated activity being delivered will be required to have had both vaccines, both doses of the coronavirus vaccine. We're calling this VCOD, so it's a vaccination as a condition of deployment. And so from the 6th of January, a grace period has been entered, which allows organisations to implement this legislation, and the regulations come into force on the 1st of April this year. So what that means is individuals who haven't been vaccinated as yet and who are delivering CQC regulated activity or are entering areas where CQC regulated activity is undertaken will be required to have the first vaccine on or before the 3rd of February to allow the second vaccine to be administered by the 31st of March. This doesn't include boosters, it is just the first and second dose of the COVID vaccine, and it doesn't include the flu vaccine either. So the process that we've developed as an organisation is we've developed a multidisciplinary working group that have been looking at the legislation and looking at implementing the legislation. And that includes, as I say, a multidisciplinary group where we've worked through lots of different scenarios in terms of picking up students, volunteers, etc. And we're working with our staff who have not yet taken up the mandatory vaccine, or the vaccine, should I say. What's happened is that individuals have had a letter if you've been identified as not having had the vaccine, and conversations have happened with managers to understand what individuals' view is in terms of having the vaccine. And second letters will be coming out to those individuals who have been identified as not having had the vaccine as yet. We're wanting to support individuals to make an informed choice regarding the vaccine, and so we want to have supportive, compassionate conversations with individuals to understand if there's any questions or concerns that we can overcome, or if there's any flexibility, such as if individuals are needle phobic, and how we can work around individuals' concerns. But what is really important is individuals do have a choice in relation to this. We've now had some national guidance come out in relation to the process going forward. So individuals who remain unvaccinated following the 3rd of February will be invited to attend a meeting with their manager, and at that meeting there will be discussions about again, if there's any concern, person-centred discussions, along with looking at and exploring alternatives such as adjustments to roles, deployment into other roles, etc. We are really keen to work with individuals, and individuals may have seen in the press over the last few days that there is some suggestion that these timescales may be amended, but what we are receiving nationally is that the government will be implementing the legislation as of the 1st of April, and so we will continue to work on this piece of work. So Adam will be able to update in relation to what support is out there for individuals, because we recognise that, as I say, individuals may have concerns and may want to be signposted to some of our support mechanisms.
Thanks, Debbie. Yeah, I think we all recognise that this comes at a time of already increased pressure on colleagues, a lot of uncertainty, and it's important to remember that everyone that's involved in the process is potentially going to need support. So I'd encourage everyone to who feels they need that wider support to access either VivUp or the Nottinghamshire ICS Staff Support Hub that's available. As we've discussed on here previously, VivUp is a 24/7 service, and you can access that by calling the number that's widely publicised, and they do offer in the moment support. So if there's any time where you feel you need to have a conversation with a trained counsellor or someone to offer support, then that number's there. The Nottinghamshire ICS Staff Support Hub is also available to colleagues, but that is only Monday to Friday, 8:30 till 5. But both are very good sources of support for anyone who feels they need that wider support with this.
Thank you. Thanks to both Debbie and Adam for that really important update. So what I picked up from there, there's a key date looming. That's the 3rd of February. Conversations with individuals who don't have a record of vaccination continue. We've had a question here from someone who has confirmed they've had the first vaccination at Kingsmill Hospital, but there's no record on NIMS, and concerned now about not being compliant with the legislation.
Yeah, I can answer that one, thank you. So if you have had your vaccine but it's not showing on NIMS, I would encourage you to speak to your line manager and provide them with evidence of that vaccine, and then we'll be able to update the databases accordingly and register you as having had the vaccine.
Thanks, Debbie. And support, as Adam has suggested, but also I think we have an intranet page as well as communications bulletin going out tomorrow with the links in there to some refreshed frequently asked questions. And there's been a sort of a system-wide approach to ensuring that all staff across Nottinghamshire have available information and support, so that'll be updated tomorrow. Thank you. I'm just see if there's any more questions specifically on staff vaccinations before I cover some of the questions that have come in. I'll take the sort of general questions around COVID and then see if there's any more on vaccinations. So a question here from someone who's talking about wants to give an update on when we might be able to stop wearing masks in offices. I think where we are with with making those sorts of decisions is based upon our trying to ensure that we don't have outbreaks on site. We currently have 10 outbreaks across the organisation, and ensuring that coronavirus, we keep our patients safe is our number one priority. So wearing masks in the offices and wearing masks around the site, we didn't relax that in July of last year when the national rules changed, and we won't be doing so in January, or indeed today and tomorrow as they change again for public places. We will keep it under close scrutiny, making decisions based upon the conditions and the transmission rates in the community, and indeed that's also the case for our visiting restrictions that remain in place for the current period. So I've got another question around working from home. So I mentioned earlier, we still would like to encourage people to encourage people to work from home. There's a question here, or a comment, around civil servants are being encouraged to go back into their offices and no longer work from home. So I guess that may work for civil servants on non-hospital sites where there aren't vulnerable people and patients around to be subjected to that transmission. So we're mindful of that. Our work from home guidance will remain in place, did so throughout the summer when the relaxation of the national rules happened. We want to ensure that all our patients remain safe and the number of outbreaks is kept to an absolute minimum. Another question about catching COVID. Can you catch COVID more than once? You certainly can. I'm aware of a few friends or family that have caught it more than once, and I saw some update recently on Omicron, and there have been cases where the same individual has caught Omicron within 8 days. So a second dose of second outbreak of Omicron and transmission within 8 days of the first. So we must remain vigilant and don't think that we have full protection following a bout of coronavirus. I think that covers the latest questions. None on staff vaccinations so far. I am reminded about that I got my script wrong in the earlier update, and that when I was talking about the vigilance on IPC around coronavirus, I should have mentioned norovirus being the subject of recent outbreaks across Nottinghamshire. So we've certainly seen that norovirus is circulating, and that we should remain vigilant, and therefore, for example, the use of hand gel is not sufficient in that area, and therefore soap and water and washing hands appropriately is part of that vigilance. So please observe the IPC rules around all containments. Okay, so I've got rather a long. Is this being published, Danny? This daily vaccination confidence sessions. So there's someone who's given us quite a detailed description of the sessions that are in play. So can you publish that and include that in the bulletin if appropriate? Thank you. So there are a number of sessions, both locally and nationally, that are available for staff to join. I've got a question about the percentage of COVID in patients which are unvaccinated. I don't have that to my fingertips right now, but the sort of general view is that there is a high proportion of patients in hospital beds and in ITU who are unvaccinated. Okay, I think that covers all the current questions. So without further ado, Craig, I've kept you hanging on. Oh, we've just suddenly got a question on staff vaccinations that I think we should cover straight away, Debbie, if we may. So the question is, what are the consequences of not having the vaccine? Will deployment, I think it means, will redeployment for a period of time be available?
Okay, thanks, Paul, and that's a really a good question. So if individuals make the choice not to receive the vaccine, then there will be, as I say, meetings set up between managers and the staff member. They will be person-centred conversations to understand any concerns and whether we can overcome any of those concerns, and options will be discussed at that meeting. One option will be, can we make any adjustments to the current role? So while the individual may still be carrying out CQC regulated activity, can we change or make adjustments to that role so the individuals are not being deployed where the CQC regulated activity is taking place? If that is not able to happen, because that would fundamentally change the role, then we can look at deployment. What we're calling it deployment rather than redeployment, because it's deployment into roles. We're currently, as the working group, just going through what the process will look like, but it's highly likely individuals who choose not to have the vaccine and where adjustments can't be made will be emailed a number of times a week to be made aware of vacancies within the organisation which are deemed as not in scope of this legislation. Individuals would need to apply through the normal track and NHS jobs route and go through a selection process. If individuals after a period of time are not able to find alternative deployment, then we would have a further conversation with the individual, and at that conversation we would explore wider employment options and employment in the organisation. If we do have to consider that during any period, individuals would be able to remain on and apply for roles within the organisation until the 31st of March, until when the legislation comes into place. So if individuals are not able to find alternatives within the organisation, then unfortunately one of the options may be that we serve notice to bring individuals' contracts to an end, and the termination date would be the 31st of March. Clearly that's not where we want to go. We want to support individuals to make informed choices about the vaccine and look at exploring adjustments and deployment, but that is what the national guidance is outlining. We're just working through that national guidance to implement it for Sherwood Forest hospitals.
Thank you, Debbie. Really clear, and we've received another question, which, if the date of VCOD is delayed or withdrawn as speculated on national TV, will Sherwood Forest Hospital staff still be dismissed or redeployed? I guess the short answer to that is we're compliant with the legislation. So if the legislation date is delayed, then clearly any action that we're taking or required to take will also be delayed. And if it's withdrawn, then it will be withdrawn as per the national legislation and guidance. Further questions then stimulated by your answer, Debbie. Is there any guarantee of keeping the same band if redeployed?
No. So it will, so if individuals are, we can't make adjustments to individuals' roles, and we are looking at deploying individuals into different roles within the organisation. Individuals, as I say, will be communicated with the vacancies that are deemed as not in scope. That can range from all bands, so band 2s all the way up to the senior bands. And individuals would need to apply, as I say, through the normal process and go through a selection process. If individuals are appointed at a different band, they will be paid in accordance with that band, and there is no pay protection attributed to deployment into different roles as a result of this legislation.
Thanks, Debbie. Can you give some examples of roles that are not in scope, and maybe even what bandings they represent?
Yes, so some bandings and roles may be where the role, and there is absolutely no requirement for the role to go into areas where there is CQC regulated activity that is being delivered. Clearly that is a decision that the line manager would make, but I can give an example from human resources department. So I'm looking, for example, at a recruitment assistant who works within TB3, and there is no requirement for that role or that person undertaking that role to go into where a CQC regulated activity is being delivered. And as I say, it's all different bands. There are roles that are in scope and not in scope throughout the whole organisation, and a range of bands throughout the Agenda for Change banding scale.
Thanks, Debbie. But a question. Someone's obviously picked up that you're using the word deployment and I'm using the word redeployment, and asked for some clarity. We're sort of using them interchangeably to mean the word transfer to another role, or being moved to another role, or finding another role. We're using deployment and redeployment to mean the same thing. So we just clarify that we're not meaning something different and talking at cross purposes. We mean the same thing. Thank you. OK, so we return to any questions later and move to Craig. So Craig, our weekly update on our Fitness for All challenge, please.
Thanks, Paul. Morning, everybody. I hope you're all well this morning. So hopefully Danny's going to skip my slides forward for me this week, which takes away the lottery of me sharing something too soon. OK, so it's week three results today, so we're already into week 4, the final week. So if you click on again for me, Danny. So week 3, the prize for week 3 was the prize awarded to the division who accumulated the most meters whilst exercising. So that was the total for that week. So overall, we accumulated just under 2.5 million meters. That's everybody who submitted last week, which is just under 2,500 kilometers, which is just over 1,500 miles. So or 1,500 miles rather, and we logged around just under 450 instances of exercise, which is slightly below the week before, but we certainly went a lot further than we did the week before, so that's really impressive. So whilst people were exercising, doing less activities, they were going further whilst they were doing it. Now, the winning division clocked up a massive 919 kilometers in total. You click on for me, Danny. And then, because on Friday last week, when I looked, there was only 11 kilometres between the top two divisions. And I think when we share the results, we'll in a second, we'll see that gap opened up pretty significantly over the weekend. So the winner, thanks Danny, is again women's and children's. So the juggernaut continues rolling forward. So that's 2 weeks in a row that they've won. And as I say, if we just click on again for me, Danny, just move forward and again. Thanks. So they won by around about 12,000 meters in total, which is 120k. So again, it was fairly close. So onto the bit that Paul likes. So last week, just go back for me, one or forward, whichever one back. So quite apt really. So last week we got to Olympia in Greece, which is quite apt. So the home of the Olympic Games, where the first marathon was run, and that was as everybody's exercise last week meant we'd have travelled from Sutton to Olympia. So still moving forward for me, Danny. So in total we've done just under 100,000 minutes of exercise, over about just under 1,600 activities. In total, we've accumulated around about 8,500 kilometres as a group. So between weeks 1 and 2 and then weeks 3, we've actually doubled the distance. So last week we doubled the distance, which is phenomenal effort by everybody. We've burned roughly, and this is a very rough calculation, but about 1 million calories between us, which we'd need to eat, what, 4,200 Mars bars to replenish the amount of calories that we've burnt. Or if you want to be healthy, it's about just under 11,500 bananas. So where does that put us in terms of where we've got around the world? So I'm not sure about the how sensible it would be to travel to this place at the moment, but yeah, we would have made it as far as Pyongyang, which is the capital of North Korea, so far. Now, one of my colleagues asked me this morning why we're going east and why we haven't gone west, and I think the main reason is we'd be sat somewhere in the middle of the Pacific at the minute if I did this, so it's not quite as interesting. But again, I just want to commend everybody for another fantastic effort. So we're into the last week. This week's prize will be awarded to the division who've increased and showed the biggest percentage increase in their exercise during week 4 compared to week 1. So hopefully that makes it a bit more of a level playing field and not everybody's chasing women and children's tail for the rest of the week on that one. As I say, phenomenal effort, everybody. Just keep going. The winner, the final day to submit for the challenge as a whole is the 31st, which is next Monday. And then next week we'll be able to announce the winner of week 4, but also we'll be able to tell you who's going to take home the main trophy. So thank you, everybody.
Thanks, Craig. Congratulations again to the juggernaut that is women's and children's, as you say, Craig. And by the sound of it, it's a weekend juggernaut. Yes. So really get motoring at the weekend. So well done. And I found a new fact. I would have to eat 11,300 bananas to walk to North Korea. So that's useful. Thank you. Thanks for that. Okay, so I'll just cover off the last few questions that we've received, and we're still on the subject of mandatory vaccinations, except one which I'll pick up with you, Craig. Presumably this is from someone within Women's and Children's. When will we get the prize, please?
Soon is the answer to that. We're still sorting the prize fund out, but it will be soon, I promise.
Okay, thank you. So returning to mandatory vaccinations for staff, I've got a question here for you, Debbie, I think, and how will we ensure equality of adjustments to roles? So in terms of the potential that it might be seen that unvaccinated staff may be receiving preferential treatment for the adjustments for those over those staff that have been vaccinated. So, Debbie, you able to pick that up?
Yeah, thanks, Paul. So in relation to equality in general, just to clarify and confirm that nationally there has been equality impact assessment on the legislation, and equally we've done a local equality impact assessment. These are around person-centred conversations in relation to the vaccine and those staff that are in scope. Is there any adjustments? Those adjustments are not there to disadvantage anybody, but it's there to enable the role still to be conducted, but to comply with the legislation. And a very simple example of that would be maybe a role that is required occasionally to go into a clinical area to deliver a letter, for example. Can we make an adjustment to that role that they don't need to take that letter into the clinical area? In relation to anybody who is vaccinated but has any concerns, I would encourage individual staff risk assessments to be completed so we can understand what those concerns are and put any mitigations in place to support individuals' health and well-being.
Thank you, Debbie. And then a further question on quite right. All trusts should provide high quality care. That's the #1 priority for this trust. So therefore the question is about a risk to this if the mandatory vaccination rule is enforced. So Debbie, could you give an update on how we are understanding the risk to individual services and putting mitigations in place? Are you able to do that for us?
Yeah, absolutely. And I say one thing I would like to highlight is that this is government legislation, so the trust has to implement this legislation from the 1st of April. It will be illegal for the trust to deploy staff into CQC regulated activities that don't meet the requirements of the legislation. We, through the working group, we have a risk register where we're highlighting all the risks. We have weekly figures that are communicated so we can highlight each of the areas where there is a risk. Each of the divisions are aware of these risks and asked to mitigate these risks or identify actions to try and mitigate these risks. This is also reported on a weekly basis to our incident control team and our executive and board as well, and this is part of our trust risk register and also our board assurance framework. The divisions, as I say, are fully cited on these figures where there are risks in terms of professional groups or risks in terms of services, and they are working to assess those risks individually and to, as I say, develop actions to mitigate risks for any workforce loss that we may have.
Thanks, Debbie. And the last question that I can see, so are we able to share the percentage numbers of unvaccinated staff that we're in discussion with?
Yes, so currently we have 248 individuals, colleagues, who we currently don't know the vaccination status, and so we are in the process of having those conversations and updating the data in relation to whether those individuals have had the vaccine. And if they, we just don't have the information. If they have any exemptions in accordance with the regulations, such as medical exemptions, if they're under 18 or have a temporary exemption due to pregnancy, or if they've had the first and second dose. And we have had some colleagues who have identified that they're not intending to have the vaccine, and hence we will be having conversations in relation to adjustments or the deployment into other roles within the trust.
Thanks. So my calculator tells me that's about 5% of staff that we're currently in discussion with. Okay, so another question's come through. Will the sickness policy change for vaccinated or non-vaccinated staff? So if unvaccinated staff contract COVID, will it count as an absence in line with the policy?
Okay, so current guidance through NHS employers is that anybody who has COVID-related absence does not count towards any triggers in relation to the management of sickness absence, and that does not differentiate between vaccinated and unvaccinated staff.
Thank you. So that's clear. Another question: what will the trust do for those specialist areas where staff are not able to be deployed, and therefore a risk to staffing levels, and what may be the mitigations that divisions are considering around that?
So the divisions are considering those risks. It might be looking at advertising and going out to adverts. It may be looking at different staffing models and different ways to deliver services. And there may be some further conversations in terms of what services look like going forward, but that would very much be down to the divisions and services to take that forward and understand the impact and how they are mitigating those risks in terms of if there is workforce loss.
Thank you. Could you tell us what would make someone medically exempt from having the vaccine? So what are the rules and guidance around medical exemptions?
I could pick this one up, Paul, quite happily. So essentially, to be considered medically exempt, it would be if there's a reason you can't have the vaccine, if you're allergic to the vaccine, if you've had a reaction to it previously. There are also some temporary exemptions for pregnant staff members that apply as well.
Thanks, Adam. And a question returning to the issue of working from home. So thoughts on both short-term and long-term plans for working from home. So short-term, as I've already mentioned, if you can work from home, you should be doing so. In the long term, we certainly want our staff who are able to work flexibly and provide good opportunities to do so. Encourage people to work flexibly either in the office or at home and find the right means to do so. That's long term, but short term, encourage everyone to do so who can possibly do it. I think that we've come to the end of our questions there. So if I just draw this session to a close, thanks to Debbie, Adam and Craig. Lots of questions for you there, Debbie. Thank you for your answers, and as well as Adam and Craig. I'll just wrap up with a reminder to everyone to complete the quarterly pulse survey. So these are the quarterly opportunities to have your voice. They supplement the annual NHS staff survey, and there is much shorter survey, probably only about 10 questions. So please, it should be in your inbox. So please check your junk folder if you can't see it. It's from a company. It's done by a company called IQVIA, and the email address that you will have received it from is Sherwood@Optimum Contact. So please look out for that. The survey closes on Monday the 31st. So in the next few days. So on Monday the survey closes, and it's really important that you have your voice. Your voice matters. We really want to know and take a check of what you're thinking, and this supplements our planning for implementation of improvements in line with the staff survey, but also it helps us throughout the year to take a pulse check of people's feelings. So really encourage you to look out for that email. Complete the short survey by Monday the 31st. So thank you to those joining us today. We've had over 100 attendees live, and thanks again to Debbie, Adam and Craig, and indeed to Danny, who's been our comm support for today. Thanks for joining us. I'll see you all next week. Goodbye.